All right, I'm Cathy Harper with the Right Path for Washington County, and it's our community coalition. We've been around since 2003, and we work with youth.
So how have you come to work with the organization and be in the role you're in today?
Well, that's pretty easy. When my oldest son was 16 years old, he had a car accident, and our family doctor prescribed Vicodin. And that was just then being introduced in a medical facility other than people that were living with chronic pain. So we started down that journey. It was a difficult time for me. I was on city council at that time. And so I got involved with the Washington County Behavioral Health Board, and we did a lot of work. We looked at organizing a levy campaign, and so they were familiar with me. Recovery Alternatives was one of their agencies that provided direct services with people living with mental illness and addiction. And so my son was a consumer there, and I was very interested in that. As a city council person, I spoke a lot about what was happening in our family so that people realized that it's something that happens in all families. It didn't make us a bad family, it just made us someone that was looking for resources and help in our community. So we were working on looking at prevention and how prevention is everything. You know, it's a lot easier to prevent it than it is to treat it. But we also support recovery and treatment because we know that it's a continuum. You know, everything can't be prevented, so you have to have treatment and recovery as well. But anyway, so there became a position available after a grant was sought by our juvenile court judge and the director of the Behavioral Health Board at that time. And so we received a grant. It was called a state incentive grant, and it was a 5-year grant. But we had so much community support that we have continued now. We will be providing our 19th summer of safe teen and family events. So, because we know that it's not just the student, the youth, but it's really the entire family and a support system for them. So it's really a key community piece. Okay, so mostly we have a small office in the Behavioral Health Board, and they've been a huge supporter since the beginning because in 2003, both Judge Williams, our juvenile court judge, and Ron Reese, who was then the director of the Behavioral Health Board, they applied for that state incentive grant and received it. So at that time, we brought in a lot of people in the community to at least be a part of the initial group. There were probably, I don't know, maybe 150 people initially. And so after, the money was only for 5 years. And a lot of that money was for the beginning, the planning stages. That's usually the way it works when you get a large grant from the state or federal grant, that they want you to put a lot of planning in it so you have some sustainability. After that fact, we had about $25,000 left, which wasn't a lot of money. And we have grown that $25,000. We have maintained that $25,000 since the beginning. And it's been really from the support of the community, through donations, through fundraising. And, you know, and I write grants when we need to. We had to write grants over the last couple of years just to continue our markets and our pool parties and things, simply because we could not have any fundraisers. But now that we're back on the fundraising bandwagon, that's going to be I do have some grants, and we have some local support. The Women's Welfare League, you know, they help us with our market idea. The Sisters Fund has helped us this year with our market idea. And we have a couple of other grants that I'm writing right now, hoping to help us raise that last $5,500 that we need. So, but it's really been through community support. And as I said, you know, we try to be mindful of other organizations that need a lot more money than we do. I mean, $25,000 is not a lot of money to do all the things we do. And from that money, we also have to have insurance because we do so many things like our Iditarod, our medication take-back day. And we have to have insurance that encompasses not just our board members, but our volunteers, where we have a physical space. Like when we were at Marietta College, we had to insure the cars in the parking lot, the building, and we learned a lot from that, just how important that really was. Because, what we're doing is founded and grounded in credibility. And we never want to lose that community trust. That's been the most important thing. And I think that in the long haul is the thing we can be the most proud of, is that people know who we are and that they trust us. Well, my favorite thing about the organization is how many kids that we have worked with over the years that have grown up in our program and then come back and give back to the community. Because there are a couple of components. One, we have fun. Prevention is kind of the fluffy, feel-good side, and people can support that a little easier. But we know that it's very, very important. What we're doing is just a small piece of the puzzle. But we work a lot with other organizations that are youth-serving, like Ely Chapman Foundation and the Boys and Girls Club and the YMCA previously. So we know that it takes everyone. We are working on a Handle with Care initiative that we are partnering with law enforcement, and it's really involving the schools so that if there is an incident that happens, that law enforcement knows that there are kids in the household, and the next day at school they are treated with kindness. So it's kindness instead of consequences when things happen that kids have no control over. It could be anything that law enforcement was involved in the house the previous night. So it could be domestic violence, it could be an overdose, it could just be a death in the family that was naturally occurring, but it could be traumatic for kids that are in the household. So we do a lot of other things besides just the fluffy feel-good side of it. But we do have swim parties, we've had dances. Marietta College has always been a fantastic partner for years and years. We used the Gathering Place on Tuesday nights and had teen dances. But things evolve with prevention and what interests kids. So we moved into a community service component as well. And COVID kind of put a damper on the things that we do over the past 2 years. So we're excited to be back. And so we just had our spaghetti dinner at Spagna's, and that's a fundraiser. Everything that we raise goes back into our program. And I think that's another important piece. We don't need a lot of money like some other organizations do. It's just me. I'm just a part-time person. I'm also the city treasurer, so I have other roles that I'm involved in, other things I'm involved in. But we really put the focus on kids and families because we know that there's a lot of research that tells us that families that are together, and it's whatever a family component is, whether you're living with grandparents, you're with friends, whatever your family component is, that when we all work together, there is a success for kids. There is a 50% reduction in drug use over time, and I think those are really good odds. So, that's why our focus is on prevention. But our community service pieces are Iditarod. And we work with our food pantry partners because we understand and kids understand what it's like to be hungry. And so the Hunger Initiative is a big piece. And so this year we're bringing back our 10th annual after a 2-year hiatus with our Race Against Hunger. It's called Iditarod. And teams of 5 dress in silly costumes. They decorate a shopping cart and they perform some silly challenges and have a wish list shopping list that our food pantry partners tell us they need. It can be anywhere from toiletries to canned goods to shampoos, whatever, toilet paper, paper towels. And so everybody comes together, they shop for those items. We, have some silly challenges. It could be like blowing the biggest bubble. It could be eating crackers and whistling, whatever. And they're all timed races, and then all the money raised goes to our food pantry partners. There is an account at the Marietta Community Foundation, and so they divvy everything up. And product we share with the pantries that will be on hand that day because some of them participate in the race as well. Well, we never have a problem with volunteers. We have a lot of students that have like aged out of our programs, but they still like to come back and volunteer. And we have a couple of board members that started out as youth. And it's just an incredible thing because most boards, and I serve on some other boards, most boards are not fully working boards and 24/7 volunteers, and also that they have been with our program for so long and are still active. Because typically, and it's kind of it's a mixed bag, because some people would say, well, you have the same board members, so it kind of wouldn't they want to move on? And when we do have people that retire, we had people in our schools that had been with us since the beginning and they retired, but they come back and volunteer. And we had a couple of people that worked at the Behavioral Health Board that also retired, and they come back and volunteer. And we have an active group of Scouts, Troop 207 here locally. They love to volunteer. They have required community service hours. The thing with community service is that, it doesn't matter whether you're court ordered for community service, whether you choose it, whether you're working somewhere that they, encourage that. At the end of the day, we all get the same thing out of volunteering. And that is that we can feel good about it. We see other people in our community that are also volunteering. And we know how important that is, especially when you're in a small community and you have we have like all people, all incomes, and it just makes a big difference when you still see the amount of volunteers. And in a small community, people come together for the right reasons. If someone's sick, it seems like everyone rallies around that. But at the same time, we have an aging population, so sometimes it's difficult to get volunteers, especially if we have a late night opportunity for people. They might be, well, like, I'll come in the morning, but I'm not going to come in the evening. And we've just never had that issue. We've worked with the O'Neill Center and had senior volunteers. We do medication take-back day twice a year with the sheriff's office and the hospital. The hospital's been a good volunteer, United Way, the Community Foundation. I can't say enough about the volunteers that we've had in our community. It's never been an issue. Our board has, we like to have 12 members. Right now we have 10. But we're always looking for new board members and bringing in new board members, and we have a very diverse board, so we're proud of it. And most importantly, we genuinely love each other, so it makes our journey a lot easier. We all know what role we have and how when we put our roles together, it's really incredible. Well, you can tell I'm passionate about it. We have a very active board, and as I told you earlier, we have someone from the 12 sectors, so someone from school, someone from law enforcement, and we have some retired people. We have a school counselor. We have our juvenile court judge, and so it's very important that we have community members that are looking at this and saying, this is a great thing. And it's also been divine intervention, because we have come down to where we have very little money, and all of a sudden it's like, people have stepped up to the plate. So during the pandemic, we introduced an idea, which was to have a mini farmers market just for kids. Mm-hmm. And so at one of our pool parties, we partnered with GoPax, that also is an organization that works with food insecurity. So we had this mini farmers market. I went to my board and I said, I've got this idea. And they said, if you raise the money for it, we'll do it. Because everything else is earmarked, media, insurance, which we have to have. So we raised the money and we had this market at the pool on just a family night. And there were so many kids that came and shopped at the market that had never tasted fresh fruit and fresh vegetables at that ground level. So we had blackberries and blueberries. We had blackberries that were like a quarter size. And they were so excited that for their $5 ticket, they just got a carton of blackberries, brought them into the pool, and ate them all. while they were swimming. And then, so one of our board members, who's our media guy from iHeartMedia, he said, if we don't do anything else next summer, because, you know, if we were, because we didn't know, but the next summer was the pandemic. So we were not able to have any of our pool nights. So because we had had success the previous year with our mini farmers market, we decided to have 3 of them. And we raised $17,000. We had 3 markets. We also shared excess with the House of Hope, which is a day hub for people with mental illness. And we shared with the Harvest of Hope, which is the food gleaning organization in our community. And then other organizations and food pantries were able to have apples and oranges and peaches and things that they wouldn't typically have. And it was all fresh. And we worked with the markets that were in that community. So if Whitten's was there, the River City Farmers Market, so everything was fresh that day. And we purchased the food outright, so we were able to share with everyone. It was absolutely beautiful. And so we are now, this will be our 4th summer with the markets, and we are raising our money now. So we've got about $10,000 already. So we're very excited about that. But last year we had fresh corn on the cob, and there were a couple of kids that said, "What is that?" They'd never seen ears of corn, and I said, "Well, that's corn." And they said, "Well, doesn't that come in a can?" So it's just putting the spotlight on hunger and what it means to kids to have access to fresh fruits and vegetables, because, you know, healthy mind, spirit, and body. That's really our goal. So. Well, a lot of times, over the years, we've become more well-known. But in the beginning, there might not have been a lot of adults that knew who the right path was. But if they had kids or school students, you know, they knew who we were. So we've, over time, I think, built a good reputation, because what we say we're going to do, we do it. And kids have always been the focal point, because we know that, you know, I know it sounds cliche, but they really are the future of our organization and of our community, because, you know, we do have a disparity in age and income in our area. And so you really need kids to understand that there are caring adults, and help them be responsible, so that they will think that our mission is important and help us carry that in to the next 19 years or longer. And I think that's an important thing to remember, that, you know, you have to have community buy-in. It's incredible. After 2 years, our last spaghetti dinner that we had at Spagna's, that was the night that the governor shut down the state. We had just finished cleaning up the kitchen, and everyone had the television on, and they were closing everything. And so, you know, as I said, our community rallied around the markets in that first year, because they were like, what are we going to do? Parents were asking us. I would see them at the grocery store or whatever, and it was like, what are we going to do? No pool parties. And it was like, we will stay connected with this market idea. And so we did, and the community supported that. But I think it's just simply because what we say we're going to do, we do it. We deliver. We know that it's important to have that continuity, especially with kids. You can't be that one more person that disappointed them, or promised them that you were going to do something or be there, and then you weren't. And so, you know, I think that that's been the key to our success, because we had the biggest spaghetti dinner that we have ever had last Sunday night. It was amazing. So, and I think that that speaks volumes. People were waiting in line. So, yeah. Well, okay, it's a funny story, because we had we worked with Media College. I know Marilee Morrow, and so we worked with the media class when we first began. And there were 2 media students that we really connected with, and they were also DJs. They had a part-time DJ business. So they had this idea. We met with the student union and decided to have Tuesday night dances. And I had always had a student from Dr. May's class, just from the nature of what we do, because I worked for Recovery Alternatives for a while. And I've been with the Right Path all this time, but we had to have an agency that was, working directly with prevention or treatment or recovery. So anyway, I always had a student from Dr. May's class, and so we did a lot of fun things, and we came up with alcohol jeopardy and prescription drug jeopardy, and all based with fidelity, which is you have to have now with prevention, with everything but prevention at one time. Even though it is the fluffy feel good, there are a lot of other components to it. So anyway, we worked with those 2 DJs, and after they graduated, they were still our DJs, and they drove every Tuesday night from Dover because we had such a good relationship with them. So they finally got married and had kids, and that dissolved, but they connected us with the DJ we use now. So we have a long history with Media College, and we've had Next Gen students, and we've served on the committee for Next Gen. We've been very involved with Marietta. It's beautiful. Their leadership program is stellar, and we encourage kids that are looking for what their life path might be to check out Marietta College because there's something for everyone here. And things like this for us to be involved in. So, yeah. Thank you.